Come in.
Hello.
Hi.
My name is Jake Penniger. I'm the nurse for tonight. How are you doing?
I'm doing okay, yeah.
Yeah? Okay. I'm here to perform a head-to-toe assessment on you, if that's all right with you.
Yeah, that's okay.
Okay, can we begin first with confirming your name and date of birth, please?
My name is John Doe, born January 1st, 2001.
Okay, I'm gonna confirm with your name bracelet here. Great, those match up. Would you mind telling me the date today?
It's March 5th.
Okay, that's great. And do you know why you're in here today?
Yeah, I stubbed my toe like maybe 5 days ago and it's still hurting.
Okay. What foot is the toe on?
My left foot.
Left, and it's the big toe, or which toe is it?
It's the big toe and it's partially the toe over.
Okay.
Yeah, the second toe.
Sounds good. So first and second toe on the left foot.
Yes.
Okay. And it's been in pain for 5 days, you said?
Yes.
Okay. I'm gonna talk in kind of elaborate more on that pain if you're fine with that.
Okay.
Okay. Okay. So, first, are you taking any medications in general?
Just naproxen.
Naproxen. Okay. Do you know what that is for?
For the pain.
Okay. And do you know your medication that was prescribed to you for that, or that you take for that? Like how much, how many times a day, or what dosages?
Take it once a day. I believe it's 500 milligrams.
Okay. Okay. Do you have any other symptoms or new symptoms since you've gotten that toe injured?
I guess over the 5 days, it's kind of been swelling.
Okay.
It's still pretty red.
Okay.
And that's about it.
Is it tender to touch? Like,
yeah.
Yeah. Okay. Tenderness. Okay. Good to know. Any other symptoms? Just general in your body. Anything else?
No, I think everything else is fine.
Okay. Is there anything that makes that pain worse? Since it's been 5 days of this pain. Do you think it makes it worse?
Walking around does make it hurt a little bit more.
Okay. And does it start with anything? Like, is it just like you walk and then it starts, or does it start with anything else before the walking?
If I walk, yeah.
Okay, just walking. Okay. Is there anything that you've done, including the medication, that has helped the pain go away a little bit or subside?
Just kind of resting it. I kind of do, what is it, the rest?
Yeah, the elevation.
Yeah, that thing.
Okay,
yeah.
great.
And it kind of helps sometimes. I'll do it at night.
Okay. How would you describe your pain? Is it numb, sharp, dull?
I would say sharp.
Okay.
Yeah.
And the radiation, is it contained in those 2 toes, or is it like, has it spread to the whole foot or the leg at all?
I just want to say it's, the toes.
Contained those,
Yeah.
okay. Great. And on a scale of 0 to 10, how would you label your pain right now?
Say about a 4.
Okay, 4 out of 10?
Yeah.
All right. And has that been consistent over the 5 days, or it's been getting worse over the 5 days?
Slightly worse over the 5 days.
Okay. Right. And how did you stub that toe?
I was cutting my grass and there was a random rock.
Oh, ouch.
Just out of nowhere, and I stubbed it.
Ouch. Okay. And does that pain that's in your foot, does it get worse at specific times during the day?
No, just whenever I walk.
Okay.
Yeah.
Okay. Okay. Great. So, your personal goal for this visit how would you describe your personal goal? Like pain reduction? Is that your main goal?
Reduction, yeah.
Okay. And what is a tolerable pain level for you? Because sometimes we can't reduce it all the way to 0 immediately. So what would be a tolerable pain for you?
I mean, as low as you could go, so I guess a 1.
Okay.
Yeah.
Okay. Just want to check so we're always on the same wavelength. Okay. So in your head to toe assessment. We're going to start with your head
Okay.
and then to your toes. I'm going to listen to your lungs, your heart, your gut. Because your toe hurts, we're going to kind of omit the walking around to decrease pressure on that. But we will do some range of motion exercises with your legs and upper body if you're all good with that.
Yeah, that's fine.
Okay. Okay. So I'm going to maintain that privacy for you. Check before I start moving around. Check that everything, the chair is completely safe. Not going to move around on us. Okay. Gonna reapply hand sanitizer. Get some gloves on. All right. Okay. We're gonna start with your head. Okay. Okay. Feeling around your head. Any tenderness, any bulges, any abnormal hair texture or thickness, and it all looks consistent. Gonna take a general look at your skin here, okay? And it looks dry, warm, and intact, and appropriate for your skin tone. So we're doing great. Okay, going to then take a look at your ears, okay? So I'm gonna just look, double check that it's symmetrical on both sides, which they are, no drainage. Gonna get my pen light here and just look a little bit in your ears. Gonna pull back. Okay. Okay, gonna feel around just behind your ears for your lymph nodes. Okay, do you feel any tenderness there?
No, feels fine.
Yeah, there's no swelling or enlargement. Gonna feel for your senses. Gonna lift up your glasses real quick. Okay, there we go. No tenderness.
Nope, feels good.
Okay, check up here. Okay, great. Ooh, there we go. Okay, go. You alright?
Yes.
Okay, gonna check your eyes. Okay?
Wait.
Yep. Okay. How long have you been wearing glasses?
All my life.
All your life. Okay. And do you know if you're nearsighted or farsighted?
Farsighted.
Farsighted. Okay. Good to know. We're gonna do the exercises with your glasses on. Is that good with you?
Yeah.
Okay. So first, I'd like you to just stare at my ear here. I'm gonna shine a quick light in your eyes to make sure that they react to light properly. Okay. Okay. Good. There's dilation. Perfect. Okay. I'm going to then want you to track the tip of this pen light wherever I take it. Okay. So I'm gonna go here. Okay. Okay. And is that okay?
Yeah.
Okay, and then I'm going to ask you to tell me when you can spot my finger, okay?
Okay.
Okay.
Yeah.
Okay?
Yeah.
Okay, don't check my eyes. Your pupils are 3, then your sclera is white, there's no redness. I'm just gonna ask you to look up for me real quick. Okay, great. No yellowness or redness underneath. Good. Okay. And then, can you hear this?
Yep.
This little noise? Okay. Both sides?
Yep.
Perfect. I'm gonna check your nose, okay?
Okay.
So, would you mind lifting your head up real quick? Great. And breathe out. I'm just gonna, okay? Breathe. Perfect. Does that hurt at all?
No.
Okay. And your septum is parallel, so that's great. Okay, I'm gonna do some face exercises before we check your mouth, okay? So can you smile for me? Yee, perfect. Scratch up your face. Perfect. And then just open and close your jaw for me. How does that feel? Any pain there?
No pain.
Okay. Okay, I'm gonna take a quick look at your mouth if that's all right. So open your mouth real wide for me. Stick out your tongue. Right, your uvula is parallel. No deviation. Teeth are grossly intact and pink. Perfect. Great. Okay. I'm just going to take a quick check and check your neck. Okay. So I'm just going to palpate down here. Any tenderness? Okay.
Or no, sorry.
No tenderness, correct? Okay. I feel for your carotid, and both pulses are the same rate.
Yeah.
That's great. And would you mind stretching your pointing your head to your left shoulder? Great. And to the other side. Does that feel strained at all?
No.
Okay. Okay. So we're then going to listen to your heart and lungs.
Okay.
Okay. Okay. So a minute. Got my wipe here. Wipe this down. Boom. Okay. Okay. Would you have a preference over the gown or on your skin?
Can you do it over, please?
Yeah, I can. Okay, just take deep breaths for me, just normal deep breaths, okay? Okay. Clear in the upper lobes. Just gonna check your lower lobes here. Okay. I'm gonna quickly just check that your chest is expanding symmetrically on both sides. So just take a deep breath in. Perfect. Okay. Quickly listen to your heart. Okay. And just breathe like you normally would. Okay. I'm gonna check first here. Great. I hear S1, S2. No other sounds here. Okay. Great. Okay. I'm listening to your alveolar for 1 whole minute. I'm going to compare it against your radial pulse to make sure that they are aligned and timed correctly.
Okay.
Okay, perfect. Okay, would you mind? Oh, I'm going to listen to your gut sound before I force you to sit. Okay, just going to jump in your chair. Okay. Okay, great. I'm gonna just reach around, listen to your back. Would you mind, like you're hugging yourself, crossing your arms? Thank you. Okay, just take deep breaths for me here. Okay. Great. It's clear in all bases, so that's awesome.
Great.
Okay, and you can scooch on back, relax in your chair there. Okay, we're gonna do some arm exercises and neck exercises, okay?
Okay.
All right, so with your neck, would you mind trying to get your ear to your shoulder? Yep, and go back to center. On the other side, just kind of isolating it. Great, and then flex. Great, and up, extend, and up. Okay, now you're just gonna rotate like you're on a little axis here.
Okay.
You slowly. How's that feel?
Okay.
Then go the opposite direction. Great. Okay. All right. We're gonna do a little resistant exercises. Okay. So I'm gonna ask you to try to touch your ear to your shoulder again, and then push back up to center. Okay. Then the other side. Okay. How's that feel?
Yeah, feels fine.
Okay. Next, we're gonna do some shoulder ones. Okay. So I'm gonna ask you to shrug, just normally, just shrug. Great. Now against resistance, I'm gonna push down, we push up. There we go. How's that feel?
Good.
Okay. We're going to now do like chicken arms.
Okay.
Okay, so just chicken. And okay, then we're against resistance. So push up. And push up. There we go. Okay, now I like to call this the mummy. So we're going to just lift up. Going to lift up.
Okay.
And down, up, and down. Okay, now we're going to do it against resistance one last time, okay?
Okay.
So up, down. Okay, now we're going to do what I call the eagle or butterfly, okay? So we're just going to span our arms out, and then down, out, down. Okay, one time against resistance, up. How does that feel?
Okay.
Like it? Okay, now we're gonna just focus on like the lower half of the arms, okay? So pretend doing bicep curls, so push against me.
Oh.
Push against me. Great. Now grab my hands. Just grab as tight as my hands, tight as you can. Great. Okay, so I'm gonna pull against your, just pull and push against my hands. Great. I'm gonna check your pulses first. Just here. You can relax your hands. Go. Okay. Check this. Great. And then I'm going to move on to your legs. All right. So we're going to do some legs exercises. So I would want you to lift your legs up,
Okay.
up against me, and then lift your legs up and then down. Push down. There we go. How's that feel on your foot? Is that okay?
It's okay so far.
Okay. Okay. We're gonna move down to your shins. So you're gonna kick from your knee up. Okay. Then against me. Great. Now I think we're just gonna focus on the right foot so it doesn't hurt your left. We're gonna do some exercise on that foot, okay?
Okay.
So we're going to point your toes up, okay, and then down, up, and down, and then do a little rotation with that, and then you can do it the other way. Perfect. And then I'm going to feel your capillary refill on both and your pulses on both, okay? Okay, feel your pulse. Okay, it's even on both sides, so that's great. Would you mind taking off your socks for me to see the capillary refill real quick?
Sure.
And then you can put them right back on. Okay. Okay. Does this toe hurt right here if I touch it?
No, it's fine.
Okay. So I'm just gonna test both sides. And they're less than 3. You can put your socks on if you wish.
Put it on later.
Okay. I'm gonna ask you to close your eyes real quick for me for 1 sec. Okay. You feel anything?
Yeah, a little bit.
Tell me when you feel something, alright?
Feel it.
Okay.
Feel it.
Good.
Feel it.
Okay. Alright. That is the major components of the head to toe assessment. Do you have any questions? I'm gonna put some hand sanitizer on again here.
No, no questions at the moment.
Okay. And so what the goal is to reduce that pain and swelling in your toes, correct?
Yes.
In your, okay. All right. Is there anything, would you like any water or food or anything?
Can I get some water?
You can, yes. Any ice with that?
Yes, please.
Okay, okay. And your call light, if you do need anything else, is right next to you.
Okay.
Perfect. And just press that big red button. I'll be right in to help you.
Okay.
Okay. And I'm going to stay a couple minutes and document all my assessment and focus on that toe. Okay. And would you want me to maintain privacy for you or move the screen for you?
Yeah, if you could close that for me, please.
Okay. And the door as well?
Yes.
Okay, great. So I'm going to come to the computer, document findings about the toe, and all right. That's all for right now. Okay, so I'm going to step out and I'll get some medications for you for that pain, okay?
Sounds good.
Okay, thank you so much.
Thank you. See you.